Hello everyone. Today's topic is errors in assessment. In the previous session, that is in the session 10, I have explained about the limitations of psychological assessment. So, let me tell you all about some of the limitations of psychological assessment in brief. Though psychological assessment provide valuable insights into people's behavior and mental abilities, psychological tests also face with certain limitations. They are number 1, resistance to psychological assessment, difficulties in the pre-authorization process, third, problems with reimbursement, fourth one, decision regarding the assessment, and the fifth one is the larger system issues. Whereas today, I'll be dealing with the errors in psychological assessment. Errors in psychological assessment can greatly harm a patient, especially if the patient receives an incorrect diagnosis at the hands of a simple scoring error. Psychologists who satisfy standard 3.04 should be vigilant when administering and scoring assessments to ensure that they are not causing any harm to their patient. Another ethical standard that relates to psychological testing is informed consent. Standard 3.10 of the APA Ethics Code advises psychologists who provide assessment to attain the informed consent of the client or clients using language that is easily understandable except when conducting assessments that are mandated by law. Some of the errors in assessment are: first is the environmental factors, second one is the competence of the counselor, third is the client's subjective state, fourth is the ethnic, linguistic and cultural differences, fifth one is the administration, scoring and interpretation. Let me explain in detail about these errors in the assessment. The first one is the environmental factors. There are various extraneous influences that may affect the reliability and validity of an assessment procedure. For example, room temperature, noise in the testing room, poor lighting, inaccurate timing, damaged test equipment, or even the test administrator may adversely affect an individual's test performance. The physical setting of the test situation, therefore, needs to be optimum so that it reduces the chance of affecting the client's performance on the test. The counselor should ensure that the testing environment is suitable and that administration procedures are uniform for all test takers and the clients. Second error in the psychological assessment is the competence of the counselor. Assessment is an important aspect of the process of counseling. Hence, the counselor must have a good understanding of the psychological assessment and must be well equipped with the different assessment techniques. If the counselor is not competent enough with regard to the assessment procedure, then the counselor may not get a proper picture of the situation and the diagnosis of the problem may not be accurate. As a result, the counseling or the therapy provided by the counselor on this basis may not lead to effective results. The third error in the psychological assessment is the client's subjective state. The subjective state of the client refers to his or her temporary psychological or physical state. Test performance can be influenced by a person's psychological or physical state at the time of testing. For example, different levels of anxiety, fatigue, or motivation may affect an individual's test results. Like that, even the mood of the client and the mood of the counselor can also affect the test situation and affect the individual's test result. Hence, as a counselor, when the psychologist is administering different tests to the client, he should need to keep in mind the emotion and motivational level of the client. And the fourth error in the assessment is ethnic, linguistic, and cultural differences. The counselor must keep in mind the diverse array of ethnic and cultural groups with their ethnic, linguistic, and cultural differences. The variations in the cultural background of the clients play an important role in determining how the client will approach the counselor and the process of counseling itself. The cultural diversities affect the way the beliefs, values, and attitudes develop in the client. As a counselor, he must be aware of this. This will make the client feel accepted and understood, so as a result of which rapport between the psychologist and the counselor becomes easier. And the fifth error in the psychological assessment is the administration, scoring, and interpretation. Psychological tests are standardized measures of behavior. They follow uniform procedure of administration and scoring. Deviation from this may lead to errors in assessment. Test results may get affected because of the variation in the way the test is administered and scored. There are different types of psychological tests. Based on administration, they can be classified as individual tests and the group tests. Counselors should have a thorough knowledge and understanding of the administration of individual tests as well as group tests. Individual tests require one-to-one supervision, whereas group tests are administered in a group setting. However, the counselor needs to know how to administer the test to a group of individuals, distributing the test booklets, giving instructions, ensuring understanding of this instruction by the group, monitoring, collecting the test booklets and answer sheets back, and concluding the testing session. A trained counselor should have competence in the test administration and scoring, which will ensure uniformity in the assessment procedure, leading to reliable results. These are some of the errors in assessment. Thank you.